Is snoring causing a problem in your house? Well, your dentist may have your solution for quiet nights and better sleep. Hi, I'm Dr. Chris Kammer, and that's all coming up next on Smile Time. The age-old nemesis of snoring. It seems we've tried everything to get rid of it, like sewing tennis balls in a bra and then wearing it backwards. Trying self-hypnosis.
I will not snore tonight. I will not snore tonight.
Then, of course, as a last resort, you've probably heard the phrase, stuff a sock in it. But don't do that. And don't give up hope, because now your dentist has a much more effective remedy. The problem of snoring begins when your tongue gets so relaxed it falls into the back of your throat and blocks your airway. As you breathe, the incoming air speeds up as it tries to get around your tongue and it vibrates the back of your throat, much like the reed of a saxophone. The good news from the world of dentistry is that we have comfortable devices that can reposition the jaw and tongue forward, allowing for an open airway. They're easy to wear. They're much like a sports mouth guard, and they've been shown to have an 85% reduction in snoring on average. This is mine. Easy to wear. And did you know that some forms of snoring can be life-threatening? Have you ever noticed when someone who was snoring becomes unusually quiet for a period of time, and then all of a sudden they snort and gasp loudly for air? Well, here the tongue falls back into the throat and completely blocks the airway. As you struggle for air in the night, your blood pressure soars until your brain wakes up and initiates that emergency response to breathe. And that's what causes that gasp that interferes with your sleep all night long. If this episode is repeated throughout the night, it can rob you of restful sleep and make you very tired during the day, and you may even doze off at the drop of a hat. To diagnose sleep apnea, a physician-referred sleep study is required. Then, once sleep apnea has been diagnosed, many people will wear a continuous positive airway pressure device called a CPAP. These devices are almost 100% effective. However, some people cannot tolerate these devices. Well, the good news is that the dental anti-snoring devices have also been shown to reduce sleep apnea, making them an excellent alternative for those that can't tolerate the CPAP air mask. So here's wishing you quiet nights and restful sleep, because when it comes to snoring, your dentist could be your best friend. And I'm Dr. Chris Kammer. Keep smiling.